Anton Jacobs, MD of Networks Unlimited, is joining me on Skype. He's going to tell us why he thinks hospitals in South Africa should be Wi-Fi enabled. Anton, thank you for joining me.
Thank you very much.
Now, what kind of benefit would Wi-Fi serve in hospitals?
With the growing demand for personal service today, and in particular personalized healthcare, it'll give the hospitals the opportunity to directly engage with patients through mobile devices during their visits. Specialists, administrative staff, they can collaborate at the bedside with their patients. And of course, mobility can offer a big boost to patient satisfaction by either improving quality, safety and efficiency of care, and in particular immediate access to records or locations, maps, etc., to where to get to particular services in the hospitals. There's actually quite a wide array of availability for Wi-Fi solutions in the healthcare industry.
Now, are we seeing Wi-Fi in hospitals in South Africa right now?
Interestingly enough, we have recently provided Wi-Fi services to a group, a private medical group in South Africa. Unfortunately, we're not allowed to, or haven't been given permission to divulge the information. But they've just rolled out 52 sites in their first phase, and it's been a tremendous success.
Now, what kind of benefits are they seeing from having the Wi-Fi in the hospital? What measures their success? What's their success measured by?
I think it's a combination of two things. So first of all, I think it's a service to customers. The ability for people in terms of bring your own device or mobile devices into an environment and being able to provision themselves. So there's no load on the IT industry or the IT department within the hospital. The way that it works is you will walk into this environment and then be able to log onto the personalized console for the particular hospital and then provide or provision yourself onto that environment. That means that the equipment you're using has to be very reliable and always have the availability always be on. And then of course beyond the automated device onboarding, things like mobile apps that are being developed for the healthcare industry, like identification records, the ability to provide information and services to remote locations or mobile services in the healthcare industry. There's a very, very wide array. And in particular, obviously, doctors consulting before making decisions, being able to access that information quite easily between hospitals or those working from private clinics.
Now, this is how it will help healthcare providers. Will it serve any purpose for patients who are in the hospitals?
There have been discussions and comments made about improved time of recovery. I think with the social media and the ability for people to be in contact with the individual in the hospital or vice versa, the person in hospital being able to be in touch with the family, does kind of provide a feel-good environment. You may not necessarily get on with the person in the bed next door to you, but at least you can communicate with those in your family who care where you are. And that obviously does help. And if you look at it from a business perspective, the quicker people recover, the more people you can service. And I think that's obviously a driver for the healthcare industry.